Local doctors are warning tonight about an alarming rise in the number of North Texas children they're seeing trying to harm themselves. This is according to new data from Cook Children's Medical Center. Brooke Katz once again revisit with her in studio. A look at the numbers, Brooke, what's driving them, and obviously I think what parents need to look out for as well.
And Doug, the hospital says it treated 37 children who attempted suicide in September. That is the most they have seen in the 5 years they have been tracking attempted suicides.
It's the highest ever.
Dr. Kia Carter with Cook Children's Hospital says it's a number that's been rising year after year. While the hospital typically sees higher numbers in the fall months as kids head back to school, this year there's added stress from the pandemic.
We're seeing the kids struggle really with the adjustment for virtual school and the stress for parents having to figure out how to homeschool, figuring out, job loss, stressors with financial things. So all of that kind of boiling up, and kids sense the pressure.
At Children's Health in Dallas, Dr. Roshini Kumar says that she's seen an increase in patients being treated for anxiety and depression. She says checking in with your kids is a necessity.
I really recommend that families have a consistent time of day when they all check in with each other. Around the dinner table is a really good one. And, parents sharing how they feel is a nice model to show their children how they can express their feelings.
Among the warning signs you should look out for: irritability, declining grades, changes in eating or sleeping habits, and a lack of concern about appearance or hygiene.
At what point does it cross the threshold of maybe needing to seek out help?
So when you're checking in with them, you're offering some support and it's just not making them feel better, that can be a good time to check in with your pediatrician, with a therapist, to figure out ways to make it better.
And Dr. Carter with Cook Children says usually their patients are 14 to 15 years old, but more recently, the majority have been around just 12 to 13, some even younger. And just a reminder for everyone, help is always available. You can call the National Suicide Prevention Lifeline 24/7. That number is on your screen, 1-800-273-TALK, 1-800-273-8255. Doug?
It's a tough road for so many. Brooke, thank you.